Hello, my name is Nilendra Gupta. I'm the Chief of Physics and the Residency Program Director here at the Ohio State University James Cancer Hospital, Department of Radiation Oncology. And on behalf of all our physicists, our dosimetrists, our physics residents, and the entire department, I'd like to welcome all of you to this virtual tour of our department that has been put together by our residents. I hope you enjoy the tour in lieu of being able to be here in person and get to learn about our department. We have a large department here at the James. In fact, behind me is our main campus building, the James Cancer Hospital, where we have 7 TrueBeam Linacs, 3 of which are our stereotactic machines. We also have a very robust brachytherapy program, as well as an intraoperative radiotherapy program and a gamma knife program, among other things here. Also located about a mile or so away is our comprehensive breast center, where we also have additionally 2 TrueBeam Linacs that we use for treatments there. We are very excited about our latest expansion, which is this building behind me, which is our West Campus Ambulatory Expansion Project. Located here in this West Campus Ambulatory Expansion is our proton therapy facility, again, about a mile from our main campus location. The proton therapy facility consists of a ProBeam 360 system with 2 gantries and a fixed beam room. And the fixed beam room will have flash capabilities for research as well. Along with that, we will also have 2 Linac vaults, one of which will be populated with a TrueBeam Edge. We have a very large physics group, dosimetry group as well. Currently, we have about 24 physicists and 17 dosimetrists, and that number is rapidly expanding. So there's a lot of activity, lots of things to learn in our program, and hopefully you will get to learn about more of this as you go along with the tour.
As you enter the second floor of the James Cancer Hospital, this first hallway, which overlooks the atrium, has the external patient waiting areas. The next hallway has physician offices and administrative offices, as well as a conference room that we use for regular weekly meetings and our break room. This also has access to our brachy suite, which consists of our MR simulator room as well as our brachy OR. The next hallway houses patient exam rooms as well as meeting rooms for the clinical teams. Next, we have our treatment hallway, which has our 2 CT simulator rooms as well as our 7 linear accelerator treatment vaults. Also in this hallway, with easy access to all the equipment, is the physics workroom, where the physicists and resident desks are located. This is a temporary space while the hospital is undergoing renovations until about mid-2025, when we'll be moved to new offices in the newly constructed critical care tower. The back hallway has floor-to-ceiling windows looking out towards football stadium and provides access to the dosimetry offices. The hallway ends in a bridge leading towards the Brain and Spine Hospital, where the Gamma Knife, the Training Linac, and the Flash Mobitron and Clinac are located.
Hi, I'm Dave. Today we're brewing Redbird coffee. I'm a medical physicist / barista. The coffee station actually allows us to use either an AeroPress or a Hario V60 pour over. Every year we have a eggnog festival. Everyone brings in eggnog and some people even make some, and it's a pretty big event.
Hi, I'm Robin Hanshoe. I'm a staff physicist here, and I'm a preceptor for our dosimetry rotation for our physics residents. I wanted to tell you a little bit about our external beam treatment program. We treat over 200 patients a day. That includes 15 to 20 stereotactic treatments. We have a comprehensive list of techniques, including breath hold, total body irradiation, OSMI, total skin electron, as well as a very special table that allows us to treat patients who can't be treated on conventional couch tops. We also have a robust in vivo dosimetry program, including diodes and OSLDs that we use for general patient measurements, but also for TBI and for total scan electron. We additionally have advanced planning techniques, including knowledge-based planning, which our dosimetrists are currently using, as well as extensive scripting. We also are involved in many clinical trials, and in fact, in 2022 alone, we had the highest energy enrollment for clinical trials.
Hello, my name is Danny Christ. I'm a staff medical physicist here at The Ohio State University. We are in one of our CT simulator rooms right now. We have one that's almost an identical copy of this room with the same equipment. We sim about 70 to 100 patients per week between CT1 and CT2 room across the hallway. And we sim all sorts of setups, head and neck patients, stereotactic patients. We do gating and breath hold procedures, all sorts of treatment sites.
Hi, this is Hattie Lee, one of the physicists here. This is our physics closet. At the moment, we have two water tanks, but it's being used right now. We have all different equipment that's organized here. And I'm going to be proton rotation preceptor. So, thank you.
Welcome to the HDR suite. I'm Gavin. I'm one of the physicists here. So here at OSU, we have our own dedicated OR space for HDR. In the back here, we have our Bravos. We have our own dedicated CT scanner in here. Across the way here is our MRI, so we don't ever have to leave the OR. So mostly we treat GYN cases in here. We have a variety of applicators from basic cylinders to ring and tandems to syads. On average, we probably treat 10 patients a week or so, just fairly active. In addition, we also do LDR. We have prostate LDR that goes on in here. We have iPlax.
Hi everybody, my name is Zach Richards. I'm a physicist here at The Ohio State University. I've been here now for about 2.5 years. As you can see, we aren't in the radiation therapy department anymore. We're in the OR. This is OR 11 on the 4th floor of the James. And I'm here today to show you our intra-op Mobitron. This Mobitron we use for intraoperative treatments. This machine has the ability to deliver electrons of 3 different energies, 6, 9, and 12 MeV, using a small magnetron in the head of the machine here. We treat all kinds of different sites with this. We treat head and neck, we treat breast, we treat pelvis, we treat almost anything that can be operated on. As part of your residency, you'll get to come up to the OR. You can see in full OR scrubs during the procedure. You'll get to see patient fully open. The cone, our electron cone, as you can see here, will go directly inside the patient. We'll line up our machine just like this and deliver our radiation directly to the tumor bed inside the patient. So you'll get to see that as a part of your brachytherapy rotation. And as a part of your QA responsibilities, you'll get to come up here once a month with the physicist on call, which this week is me, to do our QA on it.
I'm Matthew Meineke. I'm one of the physicists here at Ohio State University in the Department of Radiation Oncology. Here you see our gamma knife treatment unit. So the gamma knife treatment unit differs from our normal LINACs by using radioactive material for delivering a radiation for brain lesions specifically, both functional as well as carcinomas. For these treatments, we have the capability of both doing framed delivery as well as using a mask system and employing our cone beam CT unit here. So during a treatment, we would bring the cone beam CT out, we would image the patient in the treatment position with their mask on, and then the table would proceed into the treatment unit and deliver the radiation therapy that way using cobalt-60. There's 192 sources arrayed around the patient, and the planning system can use the cone beam CT, the MRIs, and other planning images to define where those shots go in the head and deliver radiation therapy.
Hi, I'm Charles.
And I'm Megan.
We're Right now we're at the Brain and Spine Hospital with the Varian TrueBeam training clinic. We partner with Varian at sharing it for training purposes. They train their engineers on it. We allow our physics residents and our therapy students to work on it as well. We get to do some QA practice and a little research too.
This machine now is equipped with a new larger field of view detector system. We have some preclinical testing going on, and we are about to start some clinical trials on this as well. This is a part of the residency projects that we are working on.
Hi everyone, my name is Sagarika Jain and I'm a medical physicist at The Ohio State University. Currently we're in our old radiation oncology department, and we have our flash suite here where we house two machines that are capable of producing ultra-high dose electrons. We have the intra-op Mobotron as well as the Varian Clinac, and we're using these machines for small animal irradiation to investigate flash radiation therapy.
Hi, my name is Austin Fott. I'm a physicist at The Ohio State University. I work in proton therapy over at the James Outpatient Care Center. You can see it now. We're in one of our 3 proton treatment rooms. We have 2 gantry-based rooms and a fixed beam room. We also have 2 CT simulation scanners and a Varian Edge LINAC with space to put in one more LINAC in the future. During the residency program, you have 2 opportunities to come over to the James Outpatient Care Center. There's a 2-month proton therapy rotation in which residents learn about clinical workflows in proton therapy, as well as QA procedures. There's also a 1-month elective rotation in which clinical development and research projects can be done in conjunction with proton therapy physicists.
Hi, I'm Sam, and I'm one of the physicists at the Stephanie Spielman Comprehensive Breast Center. We're a smaller 2-LINAC center located about a mile away from the main campus. And we have 2 TrueBeams and a CT simulator, and we treat about 40 patients a day. And we specialize in breast cancer and breast metastases.
Hi, I'm Carla. I'm a lead dosimetrist here at the Stephanie Spielman Comprehensive Breast Center. What is special and unique about our center is we provide all breast cancer outpatient services right here in the same building. Makes it very convenient for our patients. One of our treatment specialties is that we can treat patients in a prone position, which is very helpful to reduce certain doses in areas that we don't want. And also, I don't mean to brag, but I'm going to a little bit because I believe our staff and faculty here goes above and beyond to deliver the best plan possible for our patients.